Hi there, Dr. Shelby here at Evolve Chiropractic in Woodstock. Welcome back to your second appointment. Today is a very important day because we will be discussing not only what we found with our exam findings, but why you're experiencing what you're experiencing and how we can help you here at Evolve Chiropractic. Now, before we jump into all that information, I do want to take a little bit of time to talk to you a little bit about how your body functions. Now, our body is controlled by the nervous system, which helps our body function and heal itself. Throughout our lives and throughout time, we take on a lot of stresses and a lot of traumas, whether that be physical, mental, emotional, and chemical. These stresses and traumas create postural distortions and subluxations. Now, our body is supposed to be able to function and heal itself at 100%, very optimally. But these postural distortions and subluxations can create problems within our body to where it is not functioning at 100%. Now, when we start to experience pain, that means our body is now reduced to about 50 to 60% functionality and healing capacity. And this can be any sort of discomfort, pain, ache that you notice that is outside of the norm. Now, when your body is functioning and healing itself only between 50 to 60% capacity, that means your body is in crisis and it's just trying to do anything and everything it can to keep itself moving. Now, this can only get worse over time if we don't do anything to intervene. Luckily, you're here at Evolve Chiropractic and we can help intervene. So, our first phase of care is the crisis phase. We want to get your body not only functioning and healing between 70 to 80% capacity, but we also want your body to be able to move through ranges of motion pain-free. So this is called our crisis phase. Now, this looks different for everybody, but it will involve you coming in 3 times a week to almost every day based on your body's crisis and level of care that you need. Now, this is to maintain and ensure that we are helping your body and helping you in the most effective and efficient way possible. Once we've gotten your body out of this crisis phase and your body is now healing and functioning anywhere from 70 to 80%, we will then be able to move on to the corrective phase of care. This looks like you coming in anywhere from 2 times a week to 3 times a week in order to make an effective and efficient change to your body. Now, both the crisis phase of care and the corrective phase of care will include the chiropractic adjustments, which will help with subluxation and relieving daily traumas and stresses to your body, as well as the prescribed rehab therapies, which will help make the adjustments not only more effective, but more comfortable for you as well, and the prescribed traction therapies, which will help any postural distortions that we have accumulated over time. Once we have gotten through the corrective phase of care, which is the longest phase of care, now we can move on to preventative and maintenance care. This care looks like you coming in anywhere from 1 time a week to 1 time a month, and often in between is what we prescribe for patients. But it does depend on your level and need of care for your body and to maintain anywhere from 90 to 100% of healing and functioning capacity. This also includes the chiropractic adjustments, any traction therapies we deem necessary, as well as prescribed rehab therapies. This level of care is absolutely important for everyone because we want to make sure that we are not only maintaining this functioning and healing capacity, but we prevent any further slips back into crisis care because, of course, we don't want to go backwards, only forwards. So I'm so excited to speak with you now about your exam findings and your prescribed care plan. Now, with any chiropractic adjustment or any rehab therapy, there might be some soreness afterwards, and that's totally fine. We'll talk more about that later. Ice is going to be your best friend throughout these first couple of appointments here. I'm so excited, and I'll see you soon.